lag. An environment is very, very complicated to model because environment is measured at multiple levels of exposure. Environment is dynamic, it changes all the time. And when you think, for example, of genetics, we know that our genetic code is determined the minute of conception, and the genetic code itself will stay with us until the day we die. Whereas environment keeps changing over time, and for better and for worse, your environment by the end of this day would be different than how you started this day. So it's very, very difficult to measure it and quantify it and integrate it into biomedical research. I want to introduce again, this is very superficial description of a model called the ecological system theory of development by Bronfenbrenner. Basically, what he said is that the brain or the human is developing in these different levels of exposure to environment, from very proximal to more distal environments. And if you think of the developing child, when the child is very young, the environment is highly dependent on the caregiver. So you have the caregiver environment, the household environment, and then when they grow up, there's the school environment. As we grow up in the lifespan, it's the job environment, but it's also the neighborhood environment. More broader context can be the air that we breathe, the climate that we live in, the political climate that we live in. All of these are different layers of environment, and they all contribute to health development, and it's very, very complicated. Now, I would say that in the more modern era of environmental research, there's been a new concept that was introduced, and this was just more than 20 years ago. The concept is termed the exposome. The exposome talks about all of the exposures that one is subjected to throughout their lifespan. And basically, under the umbrella term of the exposome, everything that is not genetic can be conceptualized as part of the environment of the exposure of the exposome. And the person who coined this term, his name is Christopher Wilde. He's a cancer epidemiologist. And he came from cancer research, where basically he said, we know that there are many environmental toxins and chemicals that cause cancer, but we also know that they tend to come together. So it makes very little sense to study them in isolation. We need to study them for the complex network structure. We need to study them for the complexity and embrace the complexity rather than look at them in isolation. And he termed the coin exposome. And he said that this term, the exposome, acts together with the genome to determine the health outcome, which is called the phenome. Now, this term made its way from cancer, but made its way since then in many different fields of medicine and made its way to the front stage of psychiatry with this paper published a few years ago in a leading psychiatry journal, speaking about that we need to think of the exposome if we want to advance environmental research in psychiatry. Now, when we think about youth development and adolescent development, and here I bring my lived experience as a parent to 3 kids. 2 of them are already adolescents. And we look at the world around us and the younger generation, the Gen Zers, we basically see that I would say, most of their environment is not happening in the same world that we old people or adults live in, the offline world. Most of their environment is on the online environment. Online means everything they do, which is in the virtual world, and especially during adolescence, when we know that the developmental challenges that a kid should go through involves finding their identity, creating relationships, managing socialization with peers, managing and coping with rejection from peers. Most of these interactions these days happen online. So, and there's also data to support it. I give you a few examples of research from the last couple of years about how almost half of American kids conceive themselves to be almost constantly online. This is a study from Sweden, more than 8 hours a day daily screen time. And when we just think of social media, when kids are online, they spend substantial amount of their time on social media. So this is a big, big chunk of their environment. And when we think about the exposome, we cannot ignore the digital environment because then we miss out on a major chunk of what the exposome means. And I want to coin the toss the term the digital exposome, which talks about the environment of the online world of kids. Now, this environment has been somewhat studied in recent years, I would say in the last 10, 15 years. But most of the research on the visual and virtual environment used a very crude measure called screen time. Now, I just mentioned here a few larger studies from the last few years linking screen time with various health outcomes, mental health, obesity, sleep. But the challenge is what does it really mean, screen time? And if we want to advance biomedical research and if we want to advance the field of how the digital environment contributes to health, we need to go beyond screen time and ask ourselves the very fundamental question, what does it mean when we talk about screen time? And just to give you, I mean, it's going to be the Super Bowl will be Sunday. Unfortunately, the Eagles will not be there, but some of us will watch the game for 3 hours, 3.5 hours, and this is done on a screen. But at the same time, we can do something else on a screen for 3.5 hours, like just browse different reels, or we can go online for and lose ourselves for hours and hours until the middle of the night, and watching several TikTok movies or YouTube shorts or just text with friends. Everything can be captured under this broad term of screen time. So I think that this is time for us in research and also in, I mean, just living the world and talking with our kids about it, to try and break this down to what does it really mean. And again, I mentioned the term, the digital exposome. I show you here a schematic illustration of what this means. Screen time, first of all, can be consumed or can be spent either on a smartphone or on other devices. I do want to highlight the role of the smartphone because we know that from the second or the moment that a person has their own smartphone, most of the screen time is on the smartphone. On the screen time, we can divide to social media screen time, non-social media screen time, or non-social screen time, which can include, for example, for kids, educational tasks, just watching content, also relevant for us adults. When we talk about social media, there are many types of usages, can be active use, posting, passive use, just scrolling. And of course, we need to remember it's not all just good or just bad. Probably or most likely, and I would say definitely, there are positive and negative aspects for each of these components of screen time and the digital exposome. Of course, the usual suspect for negative consequences will be cyberbullying, social comparison, which we know are challenging to health and mental health specifically. The positive aspect can be social support, community building, and several other aspects like gaining information and knowledge that can definitely be very beneficial. So I try to break down my presentation today to different questions that we try to answer with our research, and hopefully I can provide some compelling answers with the data that I'm going to share with you all, and I'll be happy to take questions later as we finish the presentation part. First question, I'm talking about the exposome and I'm talking about the digital exposome. So the first question we wanted to ask, this was a couple of years ago, can we really disentangle them in the youth experience? Because it's very difficult to do so. So we've been studying this for a few years. I want to show you one study where I think, we're able to show that the answer is yes, they can be disentangled. This is a study done I'm very lucky to be able to work with great colleagues and collaborators. This was done with Professor Anat Klomek-Bornstein from Rachman University in Israel and her PhD student Shai Arnon. This is Elina Visoki, she's the lead data scientist in my lab. And together we looked at the relationship between experiences of cyberbullying with suicidal ideation attempt in kids around age 12. and from the ABCD study. I'll talk about this study later. Most of the research I'll show you today is based on this data. What we did here is we looked at kids who underwent or experienced cyberbullying, and we tried to separate cyberbullying from offline, real world, let's call it bullying or offline bullying. And what we saw is number one, most of the kids who experienced cyberbullying were not bullied offline. And when we looked at how cyberbullying related to the risk of a kid experiencing suicidal ideation and attempts, we saw that independent of whether the kid was also bullied in the real world offline, being cyberbullied increased the chances of these kids to experience suicidality over and above offline bullying. So for us, this is a proof of concept that when you can really measure and define an online exposure from an offline exposure, even though they can be similar in context, because basically cyberbullying is bullying that happens in the digital world, we can show that this can be the two can be disentangled from each other, and we can learn how they each contribute to a health outcome, in this case suicide ideation or attempt. I can show you that overall the relationship between the two was additive, which means that both of them contributed independently to the risk of suicidality among kids. And this was actually one, if not the first paper that really highlighted cyberbullying as a unique independent risk factor for suicide risk over and above bullying. So our second question that we wanted to get at was specifically about smartphone use and teen health. And the reason we focus on smartphones is because, and I bring back our diagram of the digital exposome, smartphone is a centerpiece, it's a pivot when we start talking about screen time, and not just because we all know it as adults, because we know how much time we spend on this small screen, also because it's backed with data. This is a paper from last year that is a large population study that quantified what do kids do on their screens. And what they said across the board, this was a large study, that smartphones emerge as the most dominant medium for adolescent screen-based entertainment across timeframes. So basically, if we can say something about smartphones, we can potentially understand better how the digital environment relates to health outcomes in kids. So, what was known about smartphone ownership and health outcomes before we started the study that I'm going to share with you that was recently published? Surprisingly enough, not a lot. There was one study published last year that was a global survey study in adults from all over the world that basically asked adults in between 18 to 25, so this is young adulthood, about their well-being, and also asked what age were you when you got your first smartphone. And what they reported is that receiving the first smartphone after age 13 was associated with better well-being in early adulthood compared to receiving it before age 13. But this was in adults, and it was a survey. It was based on report of what they remembered from the past. There was one study from California that was done in a very unique population of low-income Hispanic youth with obesity. This was done as a spin-off from another project on this population. And they also looked at smartphone ownership, and interestingly enough, they found no association in this population between having or not having smartphones and health outcomes. Although again, this was a very specific study on a specific population, and the authors questions how generalizable this will be to other populations. And there was one study from 2024 that looked at smartphone acquisition in Spain and did report that earlier smartphone acquisition was associated with greater psychological distress among teens. Note that all of the outcomes here are very soft. What does it really mean? Psychological distress, mental health is very broad, definitely well-being, 5 questions is very broad. So there wasn't any strong evidence for hardcore medical outcomes. So the motivation for me and my team to study this came from for me, myself, from a very personal reason. My little one, this is our third kid, Libby, He's an amazing child, now in third grade in Keenwood Elementary. This picture was taken a few years ago during COVID when he was around 3, 4. And he is 9. When we started this study, when I started thinking of the study I'm going to show you now, he was around 8. And he started making voices that he wants his own smartphone because his siblings have their smartphones. And he also learned that they got the smartphones just around the age of 10. Because this was a few years ago. My oldest is 18. My middle son is 14. So I was thinking then, I'm not too sure about the smartphone thing so early for him because at the same time this book came out, The Anxious Generation, I'm sure you all heard of it, which basically in a nutshell says that smartphones, I don't want to overly state what the book says, but it gives the impression as if smartphone has a big role in the mental health crisis of adolescents these days. But when you read the book, you see that the data there is, I would say, as a scientist, I would say not very compelling or strong for me as a parent to take a decision. So tying this together, we said, okay, we have this amazing data resource of the ABCD study. Let's try and address this question head on. And as I mentioned before, I'm very lucky to be able to work with great colleagues and friends, scientists. One of them is Professor Andy Auerbach from Columbia, where we said, okay, let's try to use this data from the ABCD study to see whether we can learn something about smartphone ownership and health outcomes in adolescents. Now, just 2 sentences about this study. This is a national study that follows kids' development from late childhood around age 10 into late adulthood at around age 20. The kids from this study are ascertained from schools all over the US, 21 sites, almost 12,000 kids. Philadelphia or CHOP are not a site of this study, so I can just crunch the data that is collected in other places. It's a federally funded study by the NIH. And this study follows the kids from age 10 each year. And when the kids were 12, the parents or their caregivers were asked, does your kid have a smartphone? And if they said yes, there was a follow-up question. How old was your kid when they received their first smartphone? And what I show you here on the left is the age at which most of the kids got their smartphones. And you see here, the biggest bar is around age 11. This was the median age, which means that by age 11, more than half of the kids already had their own smartphone. So then together with Randy, we thought, okay, let's compare. By age 12, because the question about smartphones was asked at age 12, let's compare the health of kids with smartphones to those without smartphones. And when we looked at the numbers, we saw that there were 30%, which was almost 4,000 kids that still did not have a smartphone at age 12. And we compared them to the almost 7,000 kids that had a smartphone at age 12. So, comparing the two groups, first thing we saw is that on average, the worse socioeconomic background you came from, the more likely you were to have a smartphone. And we saw it in terms of income, parent education, and this was a very compelling finding, by the way. It's counterintuitive to some of us who may think that smartphones are expensive, so you need to be rich to get them. But the reality is that it's the opposite, actually. Smartphones are very, very cheap, and oftentimes it's populations who come from lower income that are populations where kids get their smartphones earlier. And we then looked at the health outcomes. And again, as a physician, we looked at 3 very generic health outcomes. 1, depression to represent mental health. 1 is obesity to represent general health. And 1 is having insufficient sleep. And what we see here in this graph, is that this 1.0 here with this dashed blue line represent the line at which there is no effect. The orange lines here are lines that represent the relationship between having a smartphone and each of the outcomes. You see an orange bar for depression, for obesity, and for insufficient sleep. And if the orange bar is to the right of the dashed line, it means that owning a smartphone is associated with depression, with obesity, and with insufficient sleep. What is very, very strong about the statistical model is that we were able to control for several factors that one could think could explain these differences, including age, sex, race, ethnicity, income, parent education, pubertal development, parental monitoring, and also use of other devices like iPads, laptops, and smartwatches. And this is important because you could argue and say, well, Ran, they have more obesity, maybe because they come from families where there's less money to buy vegetables, so they eat more junk food. So we took care of that in the model. And just to summarize, what we found is that on average, when you compare kids with smartphones at age 12 to those without, there's 30% greater chance of depression at age 12, around 40% greater chance of obesity at age 12, and around 60% greater chance of the kids having insufficient sleep at age 12. This is defined by 9 hours of sleep, not my definition. This is Pediatric Association definitions. Now, among the kids who already had a smartphone at age 12, I remind you that the parents or the caregivers were also asked how old were these kids when they got the first smartphone. So what we found then is that not only having a smartphone was associated with obesity and insufficient sleep, but also for each earlier year that the kid got their smartphone, there was around 10% greater chance that by age 12 the kid will have obesity or will report insufficient sleep. And again, this was telling us something that we didn't see in the previous analysis where we just compared kids with to without smartphones, but looking within kids with smartphones, seeing that earlier age of acquisition associated with greater chance of obesity and sleep insufficiency. Interestingly enough, it had nothing to do with depression at age 12, just with obesity and insufficient sleep. So we ask ourselves now, what can explain this? I mean, what is it in this machine, in this device, that can explain these adverse associations of smartphones with health outcomes? And this is something we're starting to look into now as we speak. And if I want to sharpen the question now, and you're all expert in our terminology, we can ask, how do smartphones change or affect the youth digital exposome? So again, I mentioned how lucky I am to be able to work with very smart people. This is Dr. Ziv Bren. He's an adolescent medicine physician, pediatrician, now doing a postdoc in my lab. And he asked the question of, okay, what is different in the digital exposome of kids with and without smartphones at age 12? And here's a very high level answer for you guys. So kids who have smartphones spend more time on screens, 36% more time on screens, have 35% more chance of being cyberbullied, and have more than double the chance of having a social media account. So this by itself, all of these three were already considered before the study as potential risk factors for adverse health or specifically mental health outcomes. Now, interestingly enough, having a smartphone has minimal effect on the level of physical activity. And this is interesting because one potential explanation for the findings I showed you before, where having smartphone is associated with bad mental health and obesity, you could say, well, we know why this is, because if a kid has a smartphone, then they don't run outside, they don't do sports, so they become more obese and maybe more depressed. So at least that we know is not the case, because there was very minimal difference in this data set in the levels of physical activity between the kids with and without smartphones. So the next question we wanted to answer, which I think is the most important critical question to answer, is whether there is a causal relationship between smartphones and adolescent health. And I will argue the causal relationship needs to be in the direction from smartphone to adolescent health and not vice versa, for us to really learn something to inform policy, interventions, and I will say for me as a parent, to decide when Libby, again, to decide as a family, when Libby is at the age that we think is safe for him to get his smartphone. So how do we do it is a big, big, big challenge. And again, I turn to my very smart friends, and one of them is Professor Samuel Pimentel, who is a statistician from UC Berkeley, and his expertise is a field in statistics that's called causal inference. Causal inference is this very exciting field in statistics that can use data that is not designed as a trial to try and deduce or infer causality. And smartphone questions is a really good use case for such a scenario where we do not have the opportunity or the possibility to do a placebo-controlled trial where we give half of the population smartphones, half of the population a placebo for smartphones, and just see how they behave over the course of time. Because smartphones are not a medication. So what we need to be able to do is use observational data such as this ABCD study that follows kids naturalistically over time, and use sophisticated methods to learn something about causality. So here's what Sam suggested, where I showed him the results I just showed you from the last few slides. He said, Ran, this is interesting. He has kids as well. And he's also interested in the question, when is the right time? Or when is it safe? Or when is it less safe to give them a smartphone? So he was also interested in this question, but he's a causal inference professor, so he wants another level, higher level of evidence. Not what I showed you so far, that just compares kids at age 12, and this may be biased. He said, Ran, take all the kids from your cohort that already have a smartphone at age 12, throw them out. I don't want to hear about them anymore. I just want you to look at the kids without smartphones. And Sam already knew that ABCD study follows kids longitudinally. So he told me, do that. Take these kids age 12 and follow them up until age 13. Over the course of this year, between age 12 to 13, some of them, just by life itself, by default, some of them will get smartphones. Some of them will not. He was correct. Around half of the sample acquired smartphone between age 12 to 13, but more than half, almost 2,000, remained without smartphone at age 13. And now he said, Sam, now I want you to compare the kids who got a smartphone in the last year compared to those who did not get a smartphone in the last year. And now you can really control for the baseline age 12 health outcomes. So if you find something now, controlling for their depression, their sleep, their obesity, or their weight before they got the smartphone. Now, if you find something, I will believe you that there's something going on here from a causal perspective. So, of course, we did what Sam suggested. And the first thing that we did is we compared these two cohorts it's one cohort, but the two groups of kids, the ones that got a smartphone at age 12 and the one that remained without a smartphone by age 13. You can see how similar they were now, not as different as they were in the previous slide where we compared them at age 12. They were very close to age 12 in the beginning. After a year of follow-up, they were very close to age 13. And there was smaller differences in terms of sex and race, smaller differences in terms of parent education, although again, we saw the same trend. The kids remained without a smartphone, but the kids from the more educated families. But most importantly for me to show you here is that at age 12, there was no difference in rates of depression. There was basically no difference in BMI, which is body mass index, which is how we measure weight in relation to height. You see the numbers are very close. And there was virtually no difference in sleep. I mean, the fact that here it was statistically significant is less interesting for us. What's more interesting is whether this difference is substantial. So the kids at age 12 who acquired the smartphone later in the year slept 9.3 hours a night, and the kids who did not get a smartphone slept 9.5 hours a night, which in essence means they slept similarly, the both groups. And then we followed them to age 13, and guess what we found? We found that by the end of the follow-up at age 13, the kids who received the smartphone, acquired a smartphone in that year between 12 to 13, had greater chances of reporting mental health problems of significant clinical significance by age 13, and reported greater chances of not sleeping enough. And this is in the first year that they acquired the smartphone. Even when we controlled for the mental health and sleep at age 12, we did not see an effect on obesity. And if you want the numbers for it, the numbers were quite compelling. It was around 50% greater chance of mental health problems and of insufficient sleep for the kids who received the smartphone at age 12 when they were followed to age 13. So, synthesizing the longitudinal data that I shared with you from age 12 to 13, acquiring a smartphone at age 12 seems to be causally associated with more than 50% likelihood of having mental health problems at age 13 and around 50% greater likelihood of not sleeping enough at age 13. And this is derived in a model that can suggest causality and definitely suggest the direction is from the smartphone to the health outcomes and not vice versa, because we ruled out this option by the design of the study. Now, you can ask me, Ran, what's so special about age 12 to 13? So you already know, I shared with you that we analyzed data from the ABCD study. My first answer to your question, this is the data that we had. So this is what we studied. We did not have data from earlier time points or later time points. But I will also add that age, if I needed to choose an age to study this, it would probably be around that age, because this is an age that marks a transition from childhood to adolescence, where many changes happen to the body and also to various aspects of development. But it's a good question, okay, because people ask me, Ran, this is interesting, but what happens later? And my answer is that we're working on it. ABCD study keeps following the kids, and we are now following the same design from age 13 to 14. And I can share with you that based on our preliminary analysis, age 13 does not seem to be having a smartphone at age 13, in contrast to age 12, does not seem to show similar adverse association with depression or mental health at age 14, which suggests maybe that at age 13, kids will be more mature and more resilient to the potential adverse effects of the smartphone. And we still see that kids who receive smartphone at age 13 have slightly more sleep insufficiency or are slightly more likely to not sleep enough. But importantly, we also were able to see in this data that if the kid leaves the smartphone outside of the bedroom, this additional risk to insufficient sleep is basically nullified. And this can be, with a relatively simple intervention at the family level, this risk can be totally mitigated. What's next for our research? ABCD study is amazing, and I just shared with you all of the data that we are able to extract from it that we think is really, I hope, pushing the field forward and generating knowledge that can help us as parents, as clinicians, and hopefully also policymakers take decisions regarding smartphone use. But the problem with ABCD, and no study is perfect, is that they did not collect data, at least for most of the kids, from the smartphone themselves, and the data relies on the self-report of the child of how much they use the smartphone and what do they do on the smartphone. And we know that this is not 100% reliable. So the next generation of research that we're now working on, and I'm very lucky to work again with very smart people, and we recently got a new grant to look at data from a study that is done by a company that is offering online security for families, and they're now designing a study called the TechWise study, where they collect data from the smartphone itself and link it with online surveys that they hand participants and their parents through their phone. So this enables us to close the loop between the use itself and mental health outcomes. And if you invite me again, maybe next year, I can share with you what we learned from this specific study. So, to wrap it up, I want to thank you all for being with me. I will have we have some time for questions. I want to thank again the ABCD study. It's a federally funded study, 12,000 families to thank, amazing researchers that collected data. People from my lab, I gave credit to some of them. Kate Ran is our biostatistician, did a lot of the work that I shared with you today. My collaborators from Columbia, from Berkeley, My funders from the NIH, American Foundation for Suicide Prevention, CHOP Research Institute, and the Howe Foundation that now funded our study with Aura. And if you have more questions, you can email me. You can check out our website for updates. And I will stop here.
Thank you so much. That was really enlightening. And I would say, as just an observer of this, if I was to kind of summarize the main points, just focusing on where there was evidence of an impact, pulling from some of your slides that looking at the 12-year-olds, you said there was a 30 grader for kids to have smartphones. There was 30% greater odds of depression at age 12, you said, 40% greater odds of obesity at age 12, and 60% greater odds of insufficient sleep at age 12. And then you said for the causal issues, when you were looking at the kids who were 13, the big takeaway was that last slide, which was kids who acquired phones at looking at the kids who didn't have phones at 12 and comparing them to the kids that winded up getting phones at 13, that there was a 57% greater likelihood of mental health problems at age 13 and 50% more likelihood of sleep insufficiency at age 13. So those are just some stats I pulled from your presentation that to me are kind of, as I'm thinking as a parent, the big takeaways from your presentation. So thank you so much for doing this research. I know for parents like me and others, this is really helpful. I do have kind of one or a follow-up question, and then we'll open it up to others. I will tell folks if you have any questions, feel free to put them in the chat. Cami is with us, who is the president of the Interschool Council at Lower Merion School District, and she will be reading through the questions and will be available to answer them. So I think the main question, there are two questions I have. One is you touched on it a little bit, but I know there was one that we had talked about when we spoke earlier. Were there any kind of surprises or unexpected results of the study? What you were expecting to see, maybe that you didn't see, or what you weren't expecting to see that you did see?
Yes, thank you for that. That was a great summary of the results, by the way. I hope I did it at least as well. It was great, thanks.
Yeah.
So there are a few surprising findings. One is I was very skeptical that we'll see something in the causal analysis because it's a really, really high bar to get there. And the fact that it was significant in the subpopulations of kids who got their smartphones at age 12, for me was very compelling to see, especially when we know that these are the kids who come from families where the parents are very likely to be very mindful to the potential adverse effects of smartphones. And even there, we saw an effect of 50% increase in risk. So this was really surprising. I was skeptical we'll see anything, I must admit. Another thing that we're surprised is that we we did many additional analysis that in science are called sensitivity analysis that help you be really, really sure that your results are legit. So one of these analyses that we did is we looked at kids with what's called problematic smartphone use. Problematic smartphone use, some people may refer to it as addictive smartphone use. Everyone knows, you don't need me to say that if it's problematic or addictive, it's bad for you. That's easy. So we wanted to rule out the possibility that all that we see, all the signal comes from this subpopulation of kids with addiction or problematic use. So we took them out of the analysis. And what we saw is that the results were still there. So even if the kid doesn't get to a level that we can define as addiction or problematic, there still is some effect for smartphones on health, which was interesting. And then the last thing that surprised us, there was and there is some literature that suggests that girls are more vulnerable to the potential effects of digital exposures. This is not necessarily smartphones, but we were sort of expecting to see that whatever we see in the general population will be worst for girls, and we did not see sex differences. So, and we have a few theories why that is the case, but the bottom line is that at least at age 12 and 12 to 13, there were no sex differences between boys and girls in terms of smartphone use and health.
Thank you for that. And I think one burning question many have, because you started out the presentation talking about your motivation, and you talked about your youngest and thinking about when you were going to give him a smartphone compared to your older ones. As a parent, now that you've done the research and you see the results that you received, are you planning on doing anything differently with your own child based on what you learned from the study?
Yes, my wife and I read the paper very closely and decided that he will not get his smartphone before he's 13. That's something that we decided, and he knows that. This paper was just recently published, but the data is running in our family for more than a year. So he already knows that. So he wasn't disappointed with the paper coming out. He knew what's coming. Um, and again, I say that with our older kids, they got smartphones when they were substantially younger than 13. And I tell that to myself as a parent, and I tell that to other parents. I mean, it's okay because we do our best. And what we try to do, I mean, as scientists, is we try to generate evidence that will help parents take informed decisions based on the evidence. This is how we want to work in light of the evidence-based medicine model, where we take decisions for health based on the evidence and the science. So I must say that there wasn't very compelling evidence before this study that can really guide an informed decision. And I should also say that this is one study and it was not an experiment and it has a lot of limitations. But for me as a parent and also as a scientist, I think that there's a line when you need to say, okay, there isn't going to be a placebo-controlled trial to give me a definite answer for that. So I need to look at the level of the evidence and and say whether this is enough to take an action. So for me as a parent, and when people ask me my opinion, I think that this paper, for the very specific question on smartphones, gives a compelling answer on what to work on. It does not answer many other questions like what do kids do on their smartphone? What is the role of social media, video gaming, use of AI, patterns of use? I know nothing to say about that from our study because our study did not address it. But for the ownership and acquisition, I feel comfortable that the decision is we will wait until age 13.
Think that's helpful for many of us to hear because I know I've talked to many parents who feel like they gave their older kids a phone at a certain age and so feel like they have to kind of continue that with their younger kids. But to your point, when as we learn more, then we know better, then we do better, right? So
Yeah.
thank you for that. So we've already received a couple questions that were sent to me directly, so I'll go ahead and read them. We have two so far. The first one says, could you say a few words about the studies in Europe? Several countries have more restrictive laws for kids, and they must be based on similar research.
Yeah. So the sad answer is that they're not based on similar research. I can say, for example, when you think about what's happening now in Australia, the blanket ban on social media from age 16 is also not based on similar research. It's based on a thought that this would be better for the kids, but it's not based on data that can support such a decision. What I hope is that this will create a lot of data that I hope that policymakers and politicians will make transparent and available for researchers to study to generate data. Because what happens now in Europe, by the way, in some US states as well, there are changes in legislation, and in Europe and in Australia, it's a natural experiment. So from this natural experiment, we hope to have very strong data a year from now, 2 years from now, 3 years from now, that can guide further decisions down the line. But what is being done in Europe, people think it will be better. I'm not judging it, by the way. I think it's fine to take action, but the assumption that this is based on evidence is just, it's not there.
Thank you. I do want to say someone mentioned that it looks like the chat might be disabled. I tried to fix it if someone wants to test it out, but you can also send questions if it's not fixed directly to me or directly to Cami, who is the other person that it says Inner School Council on her face. So again, if the chat is not fixed, I try to fix it, but if it's not, you can just send us a message directly. I have another question that came through, which is what are some possible reasons for the obesity effect from smartphone acquisition if physical activity did not change significantly between the two populations?
I don't know. It's a great question. The question is about the potential mechanism. Um, there was a difference in physical activity. It was small in magnitude. I think it was something like 10%, so it was statistically significant. So this can explain some of it. Another thing that can be is maybe with smartphones, there's a change. This is me hypothesizing. I started with saying I don't know. It can be changes in eating habits. Maybe there's changes in how kids eat together with others, maybe with family. Maybe it changes in sleep that because we know that sleep and obesity are related both physiologically and also if kids go to sleep later, maybe they eat later, which we know is not ideal in terms of health. It's interesting to look at it. We didn't, and I think that in the level of granularity of data that we have in ABCD, it's probably not the right data set to address this. This will require its own individual study that tries to understand how smartphone ownership can lead to obesity. Interestingly enough, when we looked at the causal analysis from age 12 to 13, we didn't see an effect on obesity. And one thing that we hypothesized there is maybe it takes longer for obesity to develop, so we don't see it within the span of a year. But definitely something is going on here. We didn't look at it, but one needs to remember that there may be also different mechanisms on opposite directions, because maybe with smartphones there'll be a change in body image, which will reflect on the other side of obesity, maybe to lose weight. So this further complicates it, but I don't want to say that we know it. We don't. We still didn't look at it.
Okay, we have another question, which is really more around the children. Were they self-reporting on the answers that they were giving? And if so, were their parents able to see their answers? And if so, did the parents feel as though they underreported the results?
So that is a great question that pertains the methodology. The depression question, we use self-report of kids. The sleep, we use self-report in this analysis, but we also looked at parent report. The results were similar. Obesity was measured. It was the main weight and height were measured in the interview during the assessment of ABCD. Whether the parents see there is again, I don't think the parents see what the kid answer. Of course, if there's safety concern, then the parent is informed, but we didn't look at suicide ideation or attempt. This leads to a bigger question of when you do mental health research of kids, do you take the parent report, do you take the child report? There's different camps here. Where I trained, we were almost religiously taught that as kids get closer and into adolescence, you throw the parent out of the room and you speak to the teen. So I always trust the teen's word over the parent's word. Of course, that mother knows best and daddy knows best. That's always true. But when it becomes mental health aspect during adolescence, we really want to respect what the child, the teen's experience. And this is why we use that and not the parent report. For rigorous science, it's always good to look at multiple informants. So I agree, that's a good comment.
Okay. Another question came in about if somebody wanted to share this with their teenager, 14-year-old in this case specifically, how would you explain it in a way that would give her pause?
I would say that number one, I would say that smartphones and technology are not just bad, but at the same time, they're not just good. It's complicated and they have bad aspects to them and they have great aspects to them. And we are not, again, I'm speaking for myself as I have a 14-year-old at home, for example, which we discuss this often. Um, we're not trying to scare them from technology. We're not trying to tell them technology is bad for you and we want to go back to the Stone Age. We want to share the message that we care for them, they're important to us, and we want to make sure that they grow up in a safe environment so that they will grow up to be healthy adults. And there is science that is starting to emerge with some compelling data that suggests that exposure in a young age to technology, in this case smartphones, and maybe later there will be other technologies that maybe will prove to be harmful. The results show that this may be not safe, and this may be something that impairs their health. And therefore, we need to look at the data together and think as a family, what can we do to protect them? Because eventually they will have their smartphone. Eventually they will use technology. It's not that we try to deprive it from them. It's not a punishment. It's for them. And we will work with them to make sure that it's done in the safest way, in a manner that balances what they gain with what they lose. Because I'm also mindful that being the only teen in the class or the grade without social media account or without a smartphone also has implications for their health, which we didn't get into in this study. But of course, this is trivial because if all of your group network is on the text group or on whatever social media, again, and this can be even at age 17, correct? Then there will be a problem there. So it's a matter of balancing. I'm always in favor of transparent communication with kids and with teens. They understand, they know it much better than us. And at the end of the day, they're very smart also. I don't know if you follow the news from Australia. Kids have a lot of ways to circumvent the limitation. They're very smart. So we shouldn't outsmart them. I think we should share the data. I mean, this paper is very simple at the end of the day. I mean, really, I try to make it simple so that you see, well, this is not rocket science. This is black and white. You see the data. It's just not good. So you're getting a smartphone. Let's say that you're 13 and we waited. You see why. But now let's see. How will this affect your sleep? How will this affect the time you spend, doing some physical exercise and sport? How will this affect the time that you have for offline communication with your family, with your friends? Let's check in on that because we know these are all mechanisms that can explain differences in health. And I think we should start thinking of smartphones and technology use as health behaviors, the same way that we think of diet and we think of sleep and we think of substance use, alcohol use, drug use. And again, I'm not saying smartphones are drugs or alcohol. I'm not. I'm saying these are parts of adolescent development, lifestyle, and behaviors that are important for health. And I want both parents and kids to be mindful of that. And hopefully also policymakers, where the data is there, will help society take a more, I would say, cohesive stand, acknowledging that it's not one size fits all. And definitely there are families where it is mandatory for a kid to have a smartphone at age 10 because there are safety concerns, communication concerns, many individual family levels that tip the scale to giving the kids smartphone. And guess what? Most of the kids, even with smartphones, they're great. I mean, all of the kids are great, but they're healthy, they're not depressed, and they don't have obesity and they sleep well. Even with smartphones, even in our data. So we're talking about averages game, and we want to be able to give a balanced view and not to alarm, and definitely not my approach to alarm everyone that smartphones are the ultimate evil, and if we just wait until age 18, everything will be perfect. In fact, it most probably will not be, because if we keep it out of their hands until 18, then what? They're not around, they're not in school, they're not in their house, then they will go wild. Maybe we need to start earlier from 18. So just a thought.
Okay. Great. Thank you for that. Your thoughts on the pledge to delay smartphone and social media. Have you signed the wait until 8? And you can, if that's a personal question that you don't feel comfortable answering, you can say so.
Coming from where I come from, nothing too personal for me. I'll be happy to respond. I mean, I shared about my own child. I think at the end of the day that there's a balance between what you like, what the level of empowerment for an individual as a parent. What do we expect from ourselves as individual parents, and what do we expect from others to impose on us so it will be easier for us to stand up against a teen or a norm or whatever. So from my perspective, age 13, based on the data I shared, should be an age at which smartphones um, should be more positively considered to be given. Wait till 8. If it aligns with age 13, yes, I will sign it. I haven't signed it yet, but I think the age range aligns. This is something that is reasonable. At the same time, this conflicts with, freedom of choice for people to choose. I mean, again, as I said before, I am sure that there are families that there are very good reasons for the kid to have a smartphone at age that is younger than 13. I don't want to impose anything on anyone. I think that when there's enough data, people can take their own decisions, and there's also a balance between the responsibility of the individual parent to take decisions in their own family with their own kid that does not need to impose it on the rest of society. My 2 cents.
Just a point of clarification for the wait until 8th pledge. It is about just individually pledging that you are not going to give your kid a smartphone until after the end of 8th
I will
grade. And
sign. I mean, I need to. We promised him 13, so I don't want to put myself in a position where he looks at the calendar. He said, "But you promised." But
fair
again, I
enough,
shared. I think this means more than signing the pledge. I mean, yeah,
for
we're
sure.
out there. We wait until age 13 with him.
Okay. What are the opinions of your peers that do not agree with the study's conclusions?
Um, I'm trying to think. I We didn't get a lot of them so far, because the study is pretty straightforward. I mean, it's again, I think the simplicity is, and we try not to overstate and overclaim. Again, I shared with you the limitations. This is an observational study. We cannot prove causation 100%. We can only say what we say about the data that we had. So I'm very careful not to say anything about how they use the smartphones. I'm very careful not to say what happened after age 13. I'm very careful not to say what happened before age 13. I'm very careful not to say that this is generalizing to all of the kids in all of the world. But again, looking at the flip side, that's the strongest evidence that's out there now. It's 10,000, more than 10,000 kids from across the US. The models heavily control for several confounders. And the causal design is very compelling because we control for the pre-smartphone exposure. So one of the arguments that could be made is that there is reverse causality here, whereby a child may be first depressed, and then because they are depressed, they are more likely to get a smartphone because of the family dynamics around that, maybe. Or a child is first obese, has obesity, and because they have obesity, they're more likely to get a smartphone. And the same would go for first they don't sleep well, and then they get the smartphone. So the last part of the study that I shared, like the transition from age to the follow-up from age 12 to 13, pretty much takes care of this. This is the potential biggest weakness of the study up until the phase that we did this longitudinal design. And when we add the longitudinal design, it's very tough to argue now for reverse causality. So again, I didn't want to get too much into the statistics, but we also had another sensitivity analysis, which is again this additional analysis we add to make sure that we are super on top of it. And we asked a question. I don't want to get too much technical, but we ask a question in the novel methods. Again, this is not me, this is my very smart collaborators, statisticians. What should be a potential confounder, which is something that can confound the results? How big should it be to explain away the observed findings from smartphones to health? And the magnitude of the unmeasured confounder was very, very large, which means that we needed to miss a huge factor in the equation in order to get the results that we could. And this is very unlikely because I showed you how many things we controlled for: age and sex and race and ethnicity and income and parent education and parental monitoring, which talks about the family dynamic, and pubertal development and ownership of other devices. So I ask for the person with critique, I say, okay, this is what we did. Do you have anything else that you think we should have added that could kill the results? So this is my very long answer to tell you we still didn't get a lot of pushback because I think also the results more or less make sense. I mean, they may be compelling more than even I expected, but and this is open science. I didn't get into it. ABCD is open science. Every bona fide researcher can get access to the data. Our code is out in the open in GitHub. Everyone can look at it, reproduce it. I mean, that's really modern way of doing science, and I'm all in for transparency. So we think that we put it out there and we try to interpret it in a manner that is defensible, if that makes sense.
Cami, looks like that's all the questions I
I
see.
have
Did you get any more?
I do. I have a couple more.
Oh, great.
What do you think accounts for the disparity between Black, Hispanic, and white families and their associated income levels and rates of children having smartphones at an earlier versus a later age?
Yeah, so that's a great question. In a nutshell, I don't know. It's a very strong observation that we discuss in our paper. We want to hope that access to technology will mitigate disparities and not exacerbate disparities. But unfortunately, what we see here is that it exacerbates it because we know the disparities are there to begin with. And then we see that the kids who are kids from lower SES, kids of color, are more likely to get the smartphone earlier, which we see the adverse effects of that. I can give some hypotheses based on, my observation as a foreigner, immigrant, white immigrant here in America, working in Philly in shop, seeing the population that we see. I'm also a clinician. It's possible that in some instances, having a smartphone is a more affordable solution to keep kids occupied than extracurricular activities, which are very, 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 very expensive. Number one. And this, we know that technology and smartphone can keep kids busy. Number two, it's also possible when we think of potential explanations for disparities, is that access to information and knowledge is more likely to be higher among educated populations. So in America, unfortunately, race and ethnicity correlate with education. So with more education, you may know that smartphones are not as good for you. So maybe if you know that, you're less likely to give your kid a smartphone in earlier age. Again, I don't know that. I can make hypotheses about why this is the case. This will require more digging into. I think it's a critical factor that we learn to use technology to improve health equity and not to exacerbate health inequality. And this is yet another example of where technology does the opposite. So I hope this will be changed. By the way, maybe some legislation there will make a difference. Smartphones these days are for free. I will share an anecdote. When our middle son was in third or fourth grade, I don't remember, we wanted to get him a phone because he started using the school bus and we wanted to know to be in touch with him. So we went to T-Mobile or AT&T or whatever and we said, we want a dumb phone for him. And they looked at us and said, we don't have that. Why would you want a dumb phone? Take the smartphone for free. So that's also a problem. And if it's for free, that's what we took. So this can explain it to an extent. And again, I'm not arguing to make things more expensive. I'm just saying we need to be mindful how this can affect access. Hope this answered the question.
We had a similar situation when we tried to get our oldest child a phone too. It didn't exist. Another question, did you put together a smartphone contract with your children? And if so, would you recommend doing this?
We didn't. I would recommend it. I mean, I think that we would moving forward. I can say that I think it's good to discuss it with the teen beforehand, and also I think that how the teen can keep their word in an agreement is a good indicator of how mature they are and ready to get their smartphone. Because if everything becomes a conflict and if no rules can be kept, probably smartphone will just make things more complicated. So maybe wait. But it's also a motivation for a kid to, also for parents, it goes both ways, to keep within some rules of engagement. But even though we don't have a written agreement, we do have some rules in our house that we try to abide to again religiously. Phones out of the bedroom at night, and we also try to live by example and keep them outside or not next to the bed. But for the kids, it needs to be out of their bedroom at night. And even with our 18-year-old, we still keep this rule because we know that this is important. We try, again, not as religiously, but we really try when we have the chance, and we're very privileged to have the chance many times a week to have dinner together, not at the dinner table. And when we have some interactions, when we talk with family abroad, again, we're immigrants, so we try to make sure that there's no multiple screens and people on their phones. So we try, again, this is very on a personal level for each family, but I think that having agreement before getting into the smartphone, also like respecting the moment of the first smartphone acquisition makes sense to me, even though we didn't practice it. Good chance that we will practice it with our third child, because I think we took it more casually with our older kids because we didn't have the data. I think we'll take it more heavily or less lightly this time round, a couple of years from now.
Okay, another one. What do you think of tying the responsibility of having a smartphone with paying for it at age 13 or older? A way to encourage working either with consistent chores or when it's age appropriate by having a job to help learn to learn to contribute to the bill of having a phone.
So it's a good question. I think it's broader than the discussion of smartphones per se, because this could potentially be applied to any other thing that a kid gets and costs money, and how do you want to use this as a motivation for them to work and to be accountable. So I want to separate the question to two parts. This is something I think it relates to the values of specific families, because for some it will be work, for other it will be, excel at schoolwork, or I think that, whenever a family decide, my opinion, yeah, we move from data and science to opinion. So I want to give this disclosure, my opinion, off the top of my head. When we think of smartphones, they are part of life. So we all agree that by age 18, everyone will have a smartphone. So smartphone becomes a part of life. It's something that kids, it's something that kids will need to be part of society. So to try and use smartphone as some incentive, I'm not sure that's the big. So it's not a bonus, it's part of life. I don't know if I'm explaining myself. So from my perspective, I would not use that as the place to teach my kid accountability to work more and not just sit all day and not work in summer, for example. But again, this is values that I bring with me individually. I'm not preaching about it, and this is definitely not evidence. This is just an opinion. And I think it becomes something that is just, everyone has a smartphone and something that we provide our kids, again, at the age that we think is appropriate and healthy for them. And like anything else that we give them, we can discuss. I mean, my kids play sports. It's important value in our family. Should we ask them to pay for some of the travel soccer that we pay a lot on each year? I don't know, maybe. So I don't think this is different from having a phone. If anything, having a phone is part of life, like almost mandatory at a certain age. Travel soccer, who knows? Maybe it's a luxury. I don't know.
Okay, thank you. That was the last question that came in, unless you have anything else, Sarah.
I don't have anything else. Thank you, Cami. I do want to thank Rand for presenting for us and talking with us. I will say, as a parent of a kindergartner who in one breath tells me to get off my phone because it's bad for me, and in the next breath is asking me when she's going to get a phone. This gives me a lot to think about and a lot of kind of data behind conversations with her at the right point about, potentially delaying it until at least 13. I'm probably going to shoot for high school, but we'll see if I can hold strong with that. So thank you again. Thank you to everyone who joined. As I mentioned at the beginning, we did record this. I think we had a little bit of issues in the beginning, so we may have missed the first couple minutes, but it will be posted on the Interschool Council's YouTube channel. I did include a link to that in the chat, but also however you found this on the social media, we'll be sharing it on like probably the Lower Merion Parent Action Committee Facebook group and some others. So, but you can always reach out to someone on the Interschool Council if you need that link in the future. And with that, I want to thank everyone, and you guys have a great night.
Thank you guys for inviting me, and thanks for the kind words and feedback. Bye-bye.
Thank you so much. Thanks for all the great information.
Thank you. Good night.
Good night. Sarah, I think it's just us, right?
Yeah,
You
it
see
is now.
there's someone in the
I
waiting room.
know, I know. I'm not gonna respond.
I'm gonna, should I just remove?
Yeah.
Or should I admit and we tell them it's
Yeah, we can do that. Here, I'll do that real quick. Hello. For the person who just joined, we actually just wrapped up, but we did record the session and it'll be available on the Interschool Council's YouTube page. So keep a lookout for that in the next week or so.
All right, thanks.
Yeah, no
Thank
problem.
you.
Bye-bye.
Bye.
How do we stop the recording at this point?
Right now.